What's going on, everyone? Dr. Jake here again with Olson Family Chiropractic, and today we're going to be talking about low back pain. And my purpose here is to show you guys via x-ray what good motion in the lumbar spine looks like versus not so good motion. When we talk about x-rays or what the problem is in the spine, is that usually it comes down to two things. The first of which is that there's a structural problem in the spine, meaning something is not sound that is causing somebody's low back pain. The other thing that we see, which is much more common, is that the lumbar spine isn't functioning properly, meaning it's not moving the way that it should be. And that is something that we can actually see on x-ray. So what I'm going to show you guys here is I'm going to show you a good series and a bad series, and kind of what we should be looking at, how your low back should be functioning. So when it comes to the lumbar spine, what we're looking at here is that I want to see a nice smooth C-shaped curve here. So if you follow my cursor, which we can see on the screen, each one of these lumbar vertebrae are toppling over the one below it, and that creates kind of a C motion here as this person is bending to the right. What we can also see is what's called a coupled motion, meaning if we go back to somebody standing straight up like this, in between each, or in the center of each one of these vertebral bodies, you can see a little white triangle line. What that is your spinous process. These are the actual bumps that you can feel on your back if you were to feel your or somebody else's spine. So as this person bends to the right, we can see how each one of these are turning to the right. So the coupled motion, meaning this person's low back, the lumbar vertebra are leaning and they're twisting, just like they should be. That is what normal function looks like. Conversely, if we look at what's not moving properly, this person also is bending to the right. And what we can see here is that some of the vertebral bodies are doing their job, meaning that if we look right here, we can see how this bone on top of this one is leaning, but generally this looks more like the Leaning Tower of Pisa versus a smooth C shape. And we can also look to see how the spinous processes are sitting in the middle versus leaning out to the right. And that is what dysfunction or not normal function looks like. I hope that this was educational for you guys so you can see what's going on inside our bodies. We can see what good looks like versus what not so good looks like. I love talking about x-rays, so if you guys have any questions as well, you can comment on this video below and we'll get back to you. Otherwise, we look forward to seeing you guys in the office. Have a wonderful rest of your day.